Hi, I'm Emily Watkins, and this is the WBFO Disabilities Beat. This week, we are wrapping up our series of highlights from the recently passed New York State budget for 2024 to 2025. This year, direct support professionals, or DSPs, who assist disabled people with tasks of independent daily living, did not see the cost of living increase they advocated for. Today, we share part of my conversation with Craig Donatelli, an advocate with Down syndrome who lives independently with support from DSPs. Later in the interview, you hear Craig's parents, Joyce and Max, as well as Todd Varwork, the Chief Policy Officer at Western New York Independent Living, discuss their concerns with the state's funding of DSPs. This interview has been edited for length and clarity, but we have the entire discussion, including more perspectives and additional aspects of the budget, on our website at wbfo.org. Tell me a little bit about where you live.
I live in Buffalo, New York. It's a beautiful street. It's safe. And we do a lot of walking, bike rides. I'm up and back. And also that, I got beautiful staff. Colin, Phyllis, Debbie, Lisa, all of them. And, Sam and people at my program as well.
Sounds like you have I don't mean to interrupt you, but it sounds like you have a very close relationship with all the staff.
Because if I had to say with people with disabilities, what they have or home, the I have. It's like to lose staff here in program, to lose them, there is no staff and there's no money for it.
What are some of the things your staff is able to do for you in your home?
One, what is my day to cook? It was Phyllis there. She helped me with cooking. It was Debbie. She helped me with some things like Phyllis does. So it was Colin and it was Lisa and other staff do too. And also at my People Inc., wonderful staff there. There's Sam, Mary Jane, and people there helping me with being independent and also being on things there. They are doing growing today with a mom. This is her Mother's Day present. It was I had a flower that I made with program, and I do the program is I have volunteering. One, I volunteer at the Goodwill store. I volunteer at the one called Meals on Wheels, and they say, what are your favorite? My favorite Meals on Wheels are my favorite one.
So it sounds like your staff helps you do all the things that you know you're able to do. They're just there to assist you and help you through it.
Yes.
And you live with other housemates who have similar disabilities, right?
Yes. I've been there for over 10 years, 11 years now. And it's with 7 guys.
6 guys.
So it would be 6 guys.
And for these direct support professionals that provide services to so many New Yorkers, they didn't see a increase in their wages for, I believe, 10 years, correct?
That's correct. That's one of the things that was really problematic, and it's been an advocacy issue that we've been involved with probably over the last 15 to 20 years, really pushing to try to help to get pay increases for the direct support professionals. They're really doing some really necessary work and we really need to have quality people that are in those positions. And, having them barely above the minimum wage is really in a lot of ways wrong. And that's what we've really continued to push for. We asked, the agencies that provide these services across New York State, the non-for-profit agencies, they have an organization, New York Disability Advocates. And what they asked for, this provider organization asked for a 3.2 cost of living adjustment, just to be able to, increase those wages enough to start to make them more, marketable in terms of, being able to attract and retain good staff, quality staff. Unfortunately, we only got about a 2.84 percent cost of living, and also was asked for was a $4,000 wage enhancement, which did not get into the budget. So the agencies didn't get what they really needed.
Max, being an expert on the numbers, we want the listeners to kind of understand why the numbers are important.
Yeah.
Why 2.8 is a problem versus 3.2.
Okay.
Because somebody's going to say, well, you got most of your cake, you just didn't get all of it.
Well, and that 2.84 is with restrictions as well.
Correct.
Yes.
We need folks to be able to recognize the value of the direct support professional, the value of the community care worker that assists a person with a disability, right? You have to compare that with everywhere else they could go potentially to work. And what we're doing is we're chasing a situation where you could either do the reasonably difficult but very rewarding work of working with Craig and his housemates, or you could make $1.55 more an hour starting at Target.
And Craig, with these agencies and these organizations that were asking for more pay for your staff, with them not getting the rate of pay that they were asking for, are you worried that'll impact the staff who work with you now?
Yeah, because right now they're helping me with reach my goal. One is my dream and my future. My staff help me, yes, and my family and the rest of the family.
And it has to be hard when those staff change over too.
Yes,
Right?
and to help me with, they're helping with to all the way up to the ladder.
Yeah.
Thank you.
Helping you go move up the ladder of life.
Mm-hmm.
And I think the one other thing, too, that we didn't mention is that, the way that this model is, that as much as we've been able to help them to become as semi-independent as possible, when staff aren't there or we have shifts that are open, the families are the backups.
Mm-hmm.
We're the
And-
backup.
and-
That's very concerning for the future.
And yes, and particularly right during COVID, we lost a number of staff, and we as families had to pull a number of those shifts, and doing them as fairly as we could. But still, I mean, right now, Joyce and I are mobile. All the families right now are mobile, can get around, can get up, can get to the house. We're the farthest away. We live 20 miles away. We're in Hamburg. He's in Amherst. But it's a challenge. And for the future, that's one of the reasons why we're looking down the road. How is this going to look 5, 6, 10 years from now? How are we going to make sure that there's going to be staff that are going to be able to help during times when we're not able to do that? And for the future, we definitely have very serious concerns, and that's why we're doing a lot of advocacy as we can at the state level.
You can listen to the Disabilities Beat segment on demand, view a transcript, and plain language description for every episode on our website at wbfo.org. I'm Emily Watkins. Thanks for listening.